Good afternoon. How are you doing today? Good. I see. Well, it looks like it's been a while since we've seen you. Yeah, I understand. We're all getting busier and busier, it seems like. Still, it's good to make sure to get in regularly if you can, just so we can check and make sure that everything's all right. Oh, yeah, for sure. I understand. Of course. So, it looks like you've been having some trouble with headaches. Okay. And how frequently? And then usually in the afternoon or evening? I see. Okay. And how about any other concerns? Overall health, any problems? Okay. And it doesn't look like you're on any medication at the moment. And you take that for the headaches? I see. And how effective is that? Alright. Well, I'm glad that seems to be working for you. I'd say go ahead and continue doing that for the moment. Okay. Well, I don't hear anything particularly concerning in the symptoms you've described so far. Headaches are a pretty common occurrence for many people. Typically, things like lack of sleep or stress can be big contributors. In more serious cases like migraines, there are sometimes specific food triggers as well. But what I'd like to do is just to make sure that everything's okay and we can rule out anything that might concern us, I'd like to go ahead and do a cranial nerve examination for you today. It won't take us too long, and it's really pretty simple and painless, but I think it would be good just for us to make sure that everything's all right. Okay, great. So there are a number of different nerves in the skull that come out from your brain in order to control various aspects of facial movement, speech, and other senses that we associate with the head, like smell and taste. So the first nerve we're going to look at, and we'll be going through a series of different tests for each of these nerves. And what I'll be looking for in each case is just the proper response that we would expect if everything's healthy and functioning. And as I said, with the symptoms you're presenting and your oral health, I don't think there's any real reason for concern yet, but we'll go ahead and make the checks. But the first nerve will be the olfactory nerve, which olfactory being sense of smell. So I'm actually going to go ahead and have you close your eyes now. And I'm going to give you something to smell, and I want you to just tell me what it is. It's pretty common, so no trick questions on this test, so nothing to worry about there. Okay, and I want you to tell me what you're smelling. That's right, it is coffee. It's one of the most important smells there is, right? Exactly. See, I figured you'd recognize it. We're going to move on there to the optic nerve, which, as you probably know, relates to the eyes and the function of the eyes. And there's actually a couple different tests that we'll go through to make sure your visual acuity is what it should be and that everything around the eye is functioning properly. So to start with, we're going to do a eye exam chart like you do every time you go in for an eye examination. And I'm just going to have you go ahead and read a line just like you would at the eye doctor. And this way we'll make sure that there's no issues with the eye. Now, you're not wearing any contacts today? Okay, great. And do you normally? Okay, good. So I'm going to go ahead and place this chart. And what I would like you to do is go ahead and read that bottom line for me. This one right here. Great. You got it perfect. So the next test that I would like to do with you, we'll look at color blindness. Now, have you in the past been ever diagnosed with any sort of issues with issues with a specific color? I see. Well, so let's just go ahead and do the test to make sure. And I would like you to there we go. Go ahead and tell me what you see. Perfect. All right. And now I'm going to do a test that is going to kind of test the peripherals of your vision. So what I'm going to do is I'm going to put my hands out like this. And what I want you to do is point to which finger is wiggling. What I'm really looking for is which hand is wiggling the finger. Do you understand? Alright, so go ahead and look straight at me. Okay, good. Good. Alright, good. Yes, that was both. Just checking. Okay. We'll do the same test. Good. Okay. Perfect. Very good. All right. So we have one more test that we're going to do with your eye. And all I need you to do is just go ahead and look straight ahead. You can look right at this spot on the bridge of my nose, just to keep your head straight and your vision forward. Okay. Good. Everything looks good there in the eye. Okay. The next test is for the trigeminal nerve. Now this nerve actually has 3 different branches: the mandibular, maxillary, and ophthalmic. So I'm going to do tests on different parts of your face to look at each of those branches. So first, I'm just going to use this cotton wool, and I'm looking just for a response to the sensation. So I'll start with mandibular, with which is around the jawline here. Okay, and you feel that? Perfect. And then the maxillary, which is on the cheeks. Yeah, it kind of tickles, doesn't it? And that's a good sign, actually. And lastly, on the forehead. Good. Now, I'm going to do the exact same things, but I'm just going to go ahead and touch you with this blunt tool here. Okay? Let's do the jawline. Feel each of those touches. Okay, good. And now the cheek area. Do both sides again. Feeling that? Okay, looks good. And again, the forehead. Perfect, looking good. Alright, now for this next test, I'm going to touch you again with the cotton wool. But I want you to just go ahead and look straight ahead for me. And I am going to touch you on the eye. Be very light, but just go ahead and keep looking straight ahead. Okay, good. Perfect. All right. Just take a couple of notes. All right. Next up, we're going to test the oculomotor, abducent, and trochlear nerves. And these all relate to the movement of the eyes. So we actually basically use one test, which will help us verify that all of these nerves are working. All right, so all I'm going to have you do is hold your head still, look straight ahead, but then I'm going to have you follow my finger as I trace a shape through the air. Okay? Good. Looking good. And do you have any issues with double vision ever? And nothing during that test, right? Okay, good. Okay, now we have another set of tests that are going to look at facial response. So what I want you to do for me is just clench your teeth, like that. And I'm just going to go ahead and feel some muscles on the side of your face. Okay, so go ahead and clench those teeth. Good. Okay. And go ahead and clench those teeth again. Perfect. Now, what I'm going to do is I'm going to just press against your chin, and I want you to just open your mouth. So I'll give a little bit of resistance, and you just go ahead and open your jaw. Okay. And open. And again. Perfect. All right. Now, this next test is the adventurous part of the exam. That's right, you're going to have a really interesting story for your friends this evening. You get to tell them that you got hit in the face with a hammer. That's right. This actually isn't going to hurt, so don't worry. It's a real light tap that I will do under the chin. It'll just check to make sure that there's the proper amount of resistance and the expected nerve reactions that we're looking for. But you should feel free to embellish the story as desired for all of your friends you're hanging out tonight. And make up, whatever it is that you claim that you did to the guy who hit you with the hammer. Alright, so I'm just going to put this finger on your chin and light tap. And one more time. Perfect. Alright, you survived the hammer to the face. Congratulations. Everything's looking good so far. Let me just get a couple more notes here. So we have a record of all of the tests that have gone through and passed today. Make sure we get all of this stuff logged so it's there in the files for us. Okay, now for the facial nerve, what I'm going to have you do is crease your forehead. Just lift your eyebrows like this. Okay? And now I want you to close your eyes. And I'm just going to push on them some. I'm going to try to open up your eyes and just keep them closed. You understand? Alright, go ahead and close those eyes. There we go. And keep them shut. Keep them shut. Perfect. Looks good. Now go ahead and puff out your cheeks. Okay. And reveal your teeth. That means smile. Smile wide. Good. And puff out those cheeks. And smile. Perfect. Alright, next up is the vestibular cochlear nerve, and this relates to hearing. So I'm actually going to grab my tuning fork. It's actually not my tuning fork. The intern who was here this morning went home with my tuning fork, so I had to grab one out of the clinic's drawer. Hopefully he will return it tomorrow. If not, he can look forward to being kicked out of the medical profession. I'm just kidding. Kind of accident happens all the time. But all we need is this tuning fork. And I'm going to wrap it so it makes noise. And I'm going to place it against a couple of points on your head. And then I'll have a couple of questions for you. So. Okay, that's spot one. Okay, and that was spot two. So which was louder, 1 or 2? Okay. Just one more time. And spot 2. Spot 2, okay. And I'm going to do the same thing on the other side. Okay, you ready? And that's spot 1. And spot 2. Again. Spot 1. Spot 2. Spot 2? Great. Do you all know what that was? I don't know. Occasionally I get someone in with perfect pitch and they tell me right away. It's an A. And I have one more test I'm going to do with the tuning fork. So I'm just going to put it right here on your forehead. And was it louder in one of your ears? You think it was the same? Okay, one more time. It's equal? Okay, good. Yeah, they're all a little unusual, but very effective at identifying problems and relatively easy for us to walk through. Okay. All right, up next, the glossopharyngeal nerve. Yes, I knew you were waiting for it. We're all waiting for the glossopharyngeal nerve test. So what I'm going to have you do, actually, and this is the one that's just a tiny bit uncomfortable. I'm going to have you open your mouth wide, and I'm just going to touch the back of your mouth. It'll be a little bit of a gag, but that's what we want to see to make sure everything's working properly. So just kind of bear with me here. Let's open your mouth wide. Good, one more time. Perfect. Now, to hit the vagus nerve, I want you to open your mouth wide, and I'm going to look in, and then I'll have you say ah, and I'm just going to check to make sure that the muscles in your throat and your uvula are responding correctly. So go ahead and open wide, and ah. Great. All right. Now, the accessory nerve has to do with some of the muscles throughout your neck and shoulders. So for this test, first what I'm going to do is have you shrug your shoulders, but I'm just going to give you a little light pressure. I want you to go ahead and shrug against that pressure. You understand? Perfect. Okay, and shrug. And again. Perfect. And the same thing, except you're going to turn your head against my hands. And turn. And let's turn the other direction. And back the other time one more. And the other way. Good. Looking good. Right, now we are very close to the end here. Let me just note that down. Perfect. So, the last nerve test is the hypoglossal nerve. Now, to test this, I'm just going to drill a small hole into your skull. I'm kidding. No holes at all. This is actually what most people think is the most fun of all the tests, and that's because you get to stick your tongue out at me. That's right, just like you're a little kid taunting me. So go ahead and stick that tongue straight out. Oh, how rude. No, looks good. Everything overall looked very, very good. All nerve responses are normal, which is, of course, what we like to see. So what I'd recommend with headache is go ahead and keep treating with pain relief as necessary. If you can, work on reducing stress, as well as trying to get a good night's sleep each night. I know that's usually easier said than done. We all just tend to be so busy, it's hard to carve out that time, but it's a likely cause of what you're experiencing. So if you can do that and see if it kind of knocks down. If you're still having trouble with it, go ahead and give us a call, and we can talk about more things that we can do. But your examination today shows that everything is looking really good. Overall health looks perfect. So on that front, I'd say go ahead and treat it as I've outlined. And I think I actually have a pamphlet here. If I can find it. It's actually on sort of strategies for sleeping, and kind of associated with stress relief as well. So I'll go ahead and give that to you to take a look at. There you go. And like I said, if you end up having any more questions, go ahead and let us know. And it was good to see you again. And hopefully hopefully it's at least 6 months before we see you again at your next regular checkup. But if you do need, let us know, and someone will be here in just a second to show you out. Have a good afternoon. Bye.